Hi, my name is Erica Riley. Today I'll be performing the ophthalmic medication skills video. So first I'm going to gather my supplies. I have my gauzes / tissue. I have my eye drops. My eye drops is from Walgreens. Personally from my home, I have my gloves, my cloth, and my hand sanitizer, and my patient. So now that I have gathered all my supplies, I'm going to be verifying the 6 medication rights and also checking the doctor's orders. So first, I'll be verifying the 6 medication rights, which is right patient, right time, right dose, right route, right patient, right time, right medication, right dose, right route, and right documentation. So now that I have verified the 6 medication rights, I'll be checking the doctor's orders. So now that I'm checking the doctor's orders, I'll be looking at the EHR with the medication, and the medication as a doctor order is Timolol 0.25%, 1 drop in each eye 2 times a day. So now that I verified the doctor's orders through the EHR with the medication, I'm ready to go to my patient room. So now I'm going to perform hand hygiene, knock on the door, allow the patient to let me in. Now that I enter the room, close the curtains to provide privacy. Introduce myself. Hi, my name is Erica Riley. I'll be your nurse today. Can you please verify your name and your date of birth? So once I verify the name and date of birth with the wristband and it's verified as accurate, now that is done, I'll be explaining to the patient what the doctor's orders. The doctor has ordered for me to give you eye medication, which is Timolol. It's for glaucoma due to pressure in the eye. Do you have any allergies? The patient states no. This should take about 5 minutes total. Also, before we start, I want to let you know there are some side effects and some adverse side effects. So the first side effects, if any, will be dizziness or fatigue. And while I'm administering the medication, you may feel a slight burning or stinging sensation. The adverse side effects are shortness of breath and slow heart rate. If any symptoms of the adverse side effects come up, please let me know immediately. So now that we have went over the side effects, I'll be performing hand hygiene. I'm gonna put on my gloves. And now that I have on my gloves, you want to check for any drainage or crusting. If there is any drainage or crusting, you want to take a cloth and you want to make sure that you use warm tap water. So as you're assessing for crust and drainage, if any, you want to place the warm cloth over the patient's eye. You want to make sure while placing it over the eye, you are not applying pressure. You want to at least apply the cloth for about 1 to 2 minutes. And once 1 or 2 minutes is up, you want to clean from the inner canthus to the outer canthus. So now that you have that side done, you want to fold it over. And you're going to do the same thing to the other side. You want to check for any crusting or drainage. If any, you want to place the warm cloth over the eye for about 1 to 2 minutes. And once 1 or 2 minutes have passed, you want to clean from the inner to the outer canthus. All right, so now that that is done, I will be turning my patient over, making sure that my patient is still in a comfortable position. I'll be taking off my gloves. Place my gloves into the bin. Next, I'm going to perform hand hygiene again. I'm going to place my gloves, another pair of gloves again. And before administering the medication, you want to make sure that the patient is in a comfortable position. You want to make sure that the bed is elevated. Also, you want to make sure that their neck is slightly hyper how can I say it, like hyper extended. So you want to make sure that their neck is slightly hyperextended. So now that I have that done and the patient's in a comfortable position, the railings are down, I'm going to grab my tissue or gauze. I'm going to use my non-dominant hand, and I'm going to place the tissue or gauze, I'm going to place it on the bony orbital using my thumb and my index finger pulling down the lower eyelid. And when doing this, you want to instruct the patient to look up. Also, you want to make sure when administering the medication, you're 1 to 2 centimeters from the conjunctival sac. And also, you want to also keep a reminder that while administering the medication, if the patient blinks and the medication is not absorbed inside the eye, you will have to redo the steps again. So now that I have my non-dominant hand placed on the non-orbital bone with my thumb and index, I'm going to use my dominant hand, unscrew the eye drops. I'm going to place my dominant hand on the patient's forehead. I'm going to instruct the patient to look up. I'm going to pour the eye drop in the lower eyelid. All right, I poured in the lower eyelid. You're going to use the tissue / gauze to, just to pat around and just to pat under the eye. And if the patient has a systemic effect, you want to place the tissue or gauze in the nasal lamictal duct. You want to place it right here, and you want to let it sit for about 30 to 60 seconds. So now that that side is done, you're going to do the same thing to the other. You're going to do the same steps to the other eye. You're going to place your dominant hand on the forehead, and you're going to place your non-dominant hand on the bony orbital, and you're going to use your thumb and your index finger to pull down the eyelid. You're going to use your non-dominant hand, place it on the forehead, drop it into the lower, one drop into the lower eyelid. And then once you drop one drop into the eyelid, you're going to use the tissue / gauze. You're going to place it under to make sure that none of the medication drops. And for any systemic effect, if any, you're going to place the tissue or gauze in the nasal lamictal duct. Hold it for another 30 to 60 seconds. And once that is done, you're going to make sure that your patient is in a comfortable position. You're going to take off your gloves. Perform hand hygiene. You want to make sure that the patient is in a comfortable position. You want to make sure that you hand the call light to the patient. You want to also thank the patient and ask them if they need anything before you leave out of the room. You want to make sure all your supplies are gathered and thrown away. Also, you want to make sure that the railing is back up. And then after thanking the patient, I'm going to leave out the room. I'm going to document the patient, the time, the dose, the route, and the medication that was used. And after I'm done doing that, I'm also going to document if there was any effect of the medication to the patient.